Have you ever wondered why some children struggle in school while others excel, even when they put in the same effort? Or why certain behaviours might be misunderstood when there's something deeper going on? Cognitive assessments can unlock the answers, helping children, parents, and teachers understand how a young mind works. Today, we're joined by Dr. Daniel Weisberg, an expert in child psychology, to break down what cognitive assessments really are, how they help, and why they can be life-changing for young people. If you are caring for someone else, whether paid or unpaid, and no matter how many hours you do it, did you realise that you may be missing out on thousands of pounds of discounts for things that you may use every day? The Able to Care podcast is proud to be sponsored by the UK's #1 carers card. Started by two best friends who recognise that carers deserve better and are 100% committed to helping to change the lives of all carers and bringing them together as a strong community. Carers Card UK provides support, recognition and rewards. It offers reassurance by providing an ID card that helps access emergency information when needed, while also unlocking discounts, a wellbeing hub, a carers circle tool and a community through their app. All of this for less than the price of a box of chocolates a year. There are discounts on gym membership, days out, electrical goods, clothing and even glasses. Let others know you care while taking a little care of yourself with an ID card you can be proud of. Visit carerscarduk.co.uk/promo code/able to care today to order yours. Hello and welcome to the Able to Care podcast. I'm your host, Andy Baker, and today we're talking about something that can make a huge difference in a child's life: cognitive assessments. Now, we've all met children who struggle with learning, focus, or behaviour, and it's not always easy to understand why. That's where cognitive assessments come in. They help uncover how a child's brain works, giving parents, teachers, and caregivers the tools to support them in the best way possible. Our guest today is Dr. Daniel Weisberg, a highly experienced clinical psychologist and the managing director of CAYP Psychology, an award-winning service that supports children, adolescents, and young people. With years of experience in the NHS and private practice, Dr. Weisberg specializes in pediatric neuropsychology, helping families understand learning difficulties, ADHD, autism, and more. So, Daniel, thank you so much for joining me today. It's really appreciated to have you on.
Thank you for having me. It's a pleasure, and for introducing such an important topic as well. I hope I can help.
Yeah, it was really pleasing when I I had a conversation with one of your colleagues who said that this was your area of expertise, and it's an area that I sometimes find frustrating that people don't always understand. So that'd be great to hopefully raise some awareness about it and introduce the idea to more people out there. So first off, Daniel, obviously it's quite a journey. You've got a lot of experience under your belt, and I believe that CAYP Psychology is you started it, or you're a managing director. Yeah. So tell me, what's your journey? What brought you to this point?
Great question. It's something that I actually don't often think about, but lots of people ask me about, and you suddenly take a step back and think, oh my goodness me, look at where we're at. So I'm a clinical psychologist. So I was trained in clinical psychology, which is quite a generic training, a bit like medicine, really. You train in one way, and then once you're trained, you then specialize. So once I trained to be a clinical psychologist, I specialized in working with children, but particularly children with a brain-related health condition. So something like epilepsy, or a brain injury, or a genetic change that affects their brain, even metabolic disease, something that we know causes a brain change. And my role is to try to understand what that change means and how to support that child and the system around that child in making sure that they're not disadvantaged or get the best possible support out there. I practiced this at Manchester Children's Hospital in the paediatric neuropsychology team, was there for coming up to 10 years. But then I then set up CAYP Psychology, which is an independent children's psychological healthcare service. And that was just me. I rented a room in Blackpool, one hour a week. And then 1 hour became a couple more hours, and it just sort of slowly grew. I took on a couple of other psychologists who worked alongside me because I can offer a very niche area of children's psychology, but I wanted someone to offer maybe a different type of niche. And so they did that. And then it grew and grew. And suddenly I run a team now of 100 people across the whole of the UK, and we cover the widest range of children's emotional and psychological distress, but also we can also investigate autism and ADHD, as well as specific learning difficulties, which is my particular area of expertise.
Yes, it's a hell of a journey. So that's grown quite a lot. And obviously that shows the potential need out there for better psychological support for children and young people, isn't it?
That, unfortunately, is absolutely the case. So I do often take a step back and think we shouldn't exist as an independent company, which is a bit of a strange place from a business perspective.
Yeah.
We should be an NHS service. And many of my team either currently are or have been NHS members of staff, but have all experienced the same challenges, which is the children who are wanting to access the service aren't getting the support that they deserve. And that's not through clinicians' inaction, it's through systematic inaction. That there's a problem with the wider system here. The clinicians end up getting frustrated and then want to leave. So good, talented people leave. And I recognize that doesn't help the service, but we've thought, well, maybe there is an option here for families who, yes, may have to pay for it, but can then get seen by experts much more quickly and can then overcome all the pitfalls that the NHS systems do present to us. We still do, we don't go bandit and do our own thing. We still follow the NICE guidelines, they're called. That's the government approved guidelines of how we should be practicing. We use the gold standard tools. We do everything properly. We can just do it very quickly and collaboratively and make sure we get the children's needs met as best as we possibly can. And it is a shame that people have to go privately, but yes, that's a need that is out there, and that's what we do.
Now, we'll try not to go down the kind of the soapbox route too much, Daniel, but I'm very easily drawn into that. As far as one of the things that obviously you raised there is the system not quite working, and obviously we're both very aware, more than likely, that it's a very reactive system, and they're waiting until somebody meets that threshold of being an absolute level of emergency and urgency. So there's so many children and young people out there who don't meet the criteria. They're not considered to be significantly high risk enough to warrant any support and help. But at that point, then they're constantly putting out fires rather than preventing them from happening in the first place. And I take it a lot of what you do isn't just working with those who are in an absolute state of crisis. You're trying to interact with families and individuals at a much earlier stage in the process to prevent that from happening.
That is an exceptionally eloquent summary of exactly where we sit. That you're absolutely right. We live in a reactive world. I wouldn't even say it's just about healthcare. Everything we always do when something goes wrong. And I think, especially for emotional and psychological well-being and mental health, we do not have to get to that stage. And so we aim to sit at the much, much, much earlier stage where parents might recognize that something is going on here. They might talk to a GP or they might talk to a teacher, but that crisis stage is just not even on their radar. That's the time where we really want to intervene so that we can put some things in place that prevents the problem from getting worse. All the clinical evidence says prevention is far better in every metric than reacting to a crisis down the line. But yes, the system is not set up that way. So if you are a bit concerned about your child and maybe go to a GP and talk about it, there's very little that's actually out there. And yeah, I don't think that's fair. And from an education point of view, it's also the same. Schools, I think, are getting better and better at putting some things into place. But if we don't fully understand what that child actually needs, what's going on beneath that surface, those small interventions might not actually be enough. So getting that understanding at the earliest possible stage is essential. And I think, well, that's what we aim to try to do.
That's fantastic. That's fantastic. As you said, it is a shame that you are needed, and I'm sure in the ideal world, okay, I wouldn't even have a business. I'd be working still within the kind of the NHS and support. But yes, it's just not the case. One question that would be of interest, Daniel, and I kind of already know the answer, but have you seen a significantly increase in children and young people experiencing difficulties with their mental health and struggling to cope within the way that the kind of the world is set up for them, I suppose, in some ways.
Yes, we absolutely have a significant, rapid increase. Now, part of that, I think, is just an awareness of mental health difficulties,
Yeah.
and there's a conversation that more and more people are having at homes, at schools, out and about. Even just 5, 10 years ago, it just wasn't mentioned anywhere near as much as it is now. But we are also seeing the impact of multiple things that have happened to society very quickly. Social media is, of course, a big one. The impact of technology and immediate access to everything, that's certainly there. The demands of education are increasing and ever increasing. Parenting and the roles of parents, that changes, and we're just seeing a combination of all of this at once within the space of one generation. And
Yeah.
that's unbelievable. And we can sit here now talking about what we know for children in 2025. By 2030, the world will be so different. How quickly AI is coming here, how fast things are changing. And so these conversations will have to be changed again very quickly. So I suspect the challenges that we all face will get increasingly more difficult.
Yeah. Yeah. It's a kind of a sad necessity, isn't it? That something's not working. And again, but it's trying to, there's so many factors. It's a bit of a chaotic system, and it's an accumulation, as you rightly, all the different things you mentioned there, 100%. So one of the things that I think, as I say, the focus that I wanted to talk to you about, because I know this is an area of expertise for yourself, is around these cognitive assessments. Okay. So I'm kind of familiar, and I'm aware of their importance, but there's probably people out there who've never even heard of what a cognitive assessment is. So would you mind kind of breaking down what one is and why you feel they're so important?
Yeah. It's a great question because lots of people you're right, don't know what it is, or don't even know that it's a thing to properly look at. Essentially, a cognitive assessment is a formal understanding of a child's strengths and weaknesses. And for me, there are four key areas that are assessed as part of an assessment. The first is a child's intellectual abilities. So that's their thinking, their reasoning, their problem solving, their memory, their fluency, their speed of processing, anything that involves your ability to think and work stuff out. So that's the intellectual side. The second part is the academic side. So that's your reading, writing, spelling, mathematics, the academic attainments. And those two areas are assessed by looking at how a children performs, but then we compare it to how that you would expect a child of that age to be performing. So you can see, are they maybe at the right level for that age? Maybe they're outperforming their peers, or maybe they're behind. And we get a sense of how far ahead or how far behind they might be. Typically, that's where those assessments stop. You've got an assessment of thinking and reasoning and academic ability. But I think to fully understand a child, you also need to assess two further areas. The first of those is their day-to-day real-world skills. So that's everyday life, having a bath or a shower, brushing your teeth, getting dressed, tidying up, keeping clean, but also wider things like crossing roads or understanding money and understanding danger. How does that child manage in the real world? Because when we do our assessments, we meet a child in a nice clinic, it's nice and calm and quiet. It's not the real world. So we want to get a sense of what does the real world look like and how much adult support does a child need. And then the fourth area, or the second of those two other areas, is a child's emotional and psychological well-being. So looking at their self-belief and self-esteem, their anxieties, their mood, because we know that all of that can have a significant impact on their academic and intellectual abilities, and their management of everyday life. And in total, those four areas give a very clear overview of how a child is doing. It's very thorough. It's very in-depth. It's much more in-depth than, say, an educational psychologist assessment. So we often get the question of, what's the difference between a clinical psychologist and an educational psychologist? There is a huge overlap. There absolutely is. We're all interested in children's well-being and their performance, but educational psychologists specifically focus on how do we support them in school and getting the right support in school, whereas a clinical psychology assessment incorporates that, but also looks at the much wider picture. And so I think it's a more in-depth assessment. Now, these assessments are not just puzzles and tasks with kids. That's the fun bit. It's also conversations with parents. So we need to get what we call a detailed developmental history. We need to understand that child's life from the moment they were born, potentially even before they were born, all the way through to where they are today. And that gives that context of a child's life. We collaborate with school and speak with teachers because they're seeing students on a daily basis. We need to know, what do schools see and what are their concerns? And of course, we'd review any reports and correspondence about that child. So we've just got a very thorough overview of every aspect of that child's life. And at the end of it, it's all put into a very, very clear, concise report to make recommendations about what we think is going on, why we think it's going on, and what can we do to support them.
Okay, awesome. So you've already kind of mentioned a little bit how it differs from your typical kind of educational psychologist point of view. How does it differ from other kind of psychological evaluations? And how does it kind of better inform, let's say, teachers or parents to support their individual?
Yeah, that's also a very good question. So the assessments that we use are highly specialized assessments. So that means that they've been specifically designed to assess a very specific area of a child's ability. And now, if you just take that one individual test, so for example, there's one test that's called matrix reasoning. You essentially get some patterns and shapes, and then one is missing, and you've got to work out, based on what you can see, what comes next or what's missing. It's a non-verbal problem-solving task. Okay. Now, that on its own is meaningless in the real world. Like, you don't go around saying, oh, there's a shape. And so you can't just apply that particular test to the real world. It doesn't mean anything. We have to interpret that way of thinking. How does a child think non-verbally, and how do they respond to non-verbal things? It's not necessarily the technical world. So for example, if you take emotions, now emotions are completely abstract, that you can't hold anger. It's not a thing. You have to understand the concept of anger, and that is an abstract, non-verbal concept. And so by assessing that particular area in that matrix reasoning task, we then get a sense of how can that child then manage. Because if they're struggling in a classroom to manage criticism or something like that, we know they're struggling with their emotions. If we find that they're finding that particular area difficult, we can then put adaptations into place. For example, making emotions more concrete. Like, you draw out smiley faces, starting from very happy to very sad, and immediately you've created something that's much more tangible. So that, when you then sort of scale it up and look at the much wider assessment, where it's much more detailed than just, say, a quick conversation about a child's ability. We're getting really detailed. It's a little like looking at an iceberg. That's the imagery I often use. So if you look at an iceberg above the sea, you see the top of the iceberg, and that's the behavior. That's what we can see in children, and that's what it looks like on the surface. Psychologically, though, it is really important for us to understand what's going on underneath, the stuff you can't see. And sometimes that's really hard to understand, especially if a child's struggling with their emotions, or they're struggling socially. We might quickly respond to what we see, but I think it's essential that we understand why that's happening, what's happening underneath that explains all of that. And that's where these assessments can be really useful. We get that explanation.
Really nice point that you made there as far as the nature of emotions being abstract. And I think that's so I've worked with many children that, abstract concepts are really difficult for us to understand, but there's so much in life that as adults, we kind of then look back and take for granted the difference between concrete and abstract. So even simple principles of language, for instance, of like go be with, like take that with, but to be with is to be next to something. So I've encountered individuals, can you go upstairs with the clothes? But that confuses them, because how do I go upstairs but also be with the clothes? Because that's an abstract concept. Money, ownership is a big one I've come across as far as the concept of ownership as an abstract concept. Being much as Well, ownership means I have it in my hand, right? Now I own it. That's a concrete concept of ownership. But something on a shelf, well, who owns that thing on a shelf on a shop? That is just, if I was in a park, and this is a wonderful example actually that I encountered one time. It was a young lad who we were leaving the supermarket, and I noticed he got a ball in his hand, and it was from somewhere in the supermarket, football. And I said, what are you doing with that, mate? And he goes, I found it. Now, if we were in a park and we came across a ball and there was nobody else around, then what would we say? Oh, look, we found a ball. Now, he happened to have found it in the supermarket on a shelf.
I see.
But it wasn't with the other footballs.
Yeah.
Therefore, he'd found that. So that was that abstract concept of ownership going, well, that doesn't make sense. So, yeah, it's really interesting, isn't it, that people might perceive him as being naughty rather than necessarily understanding that he is being completely honest. He's not doing anything wrong in his eyes because he doesn't understand his concepts. Is that something you come across a lot with people misunderstanding that?
I absolutely love that example because that is real life, real world stuff. You know, we work with children and that happens all the time. Children's understanding of concept is different to that of adults. And it's really hard for us to see that. As adults, we are rubbish at seeing anything else other than from our own current position. There's some very famous psychology experiments, including sending people to a supermarket when they with a list of things to buy when they are full up after having a big meal versus when they are starving hungry. And you see people buy different things, even though, you know, with planning ahead here, and people base what their actions on how they're feeling right now. But children really do that a huge amount. And in addition to that, children with a neurodivergence, so children who see the world differently, struggle with those concepts even more than children, because they potentially are really rigid in their thinking, or really literal or black and white in their thinking. And we have to be very careful with words. Now, in everyday life, from a parenting point of view, you could probably manage that example with the footballer, and you can talk about it and deal with it, and it's a one-off individual event with one child. But when you have to do that in a classroom full of kids with a varying level of ability and varying levels of needs, that's really tricky, because one child's going to get it immediately. There's going to be another child who never understands that concept at all. And then children all the way between that with varying levels of ability. And a teacher's job is to grasp that. That is not easy at all. And that, again, is where our assessments can help, because if a child's particularly struggling, can we understand, is this just typical development and a child's just not quite got that skill yet? Or maybe there is something else underneath the surface here that might be making just commonplace examples really difficult for them to navigate.
So when you're doing your assessments, is it a case of the end of it, you've got kind of a documentation sort of stating individual strengths and weaknesses, or do you kind of lay it out almost on like my executive functioning is functioning at this kind of level, my social skills are at roughly this level? Is that the kind of things that you kind of map out for people from that kind of assessment?
Yes. So a lot of the assessment tools, you do the test, you get a score, we compare that score to how that child should be doing for that age, and then you report a result. And that's there. Now, I do not do that in my reports because I don't think that's really that meaningful. Oh, on this test you did this, you're at this level. On this test you got this, you're at this level. I want to know, well, what does that mean? So what I do is I integrate all of those results and put them into summary areas. So one area of verbal abilities, so your ability to talk about stuff, express yourself, share your knowledge. Another area is called working memory. That's your ability to hold information in your head whilst you then do something else. And if you just use those two examples, let's think what happens in a school. You know, a teacher stands up at the front and says, right, come on, everyone, take your books out. Let's turn to page 5. We're going to read paragraphs 3 and 4. Then we're going to answer some questions. But once you've answered your questions, then we can go out for break. You've got to do that first. That's like 5 instructions, isn't it? And if you struggle with working memory, you probably know you've got to sit down and take your book out. Can you remember what page you had to go to? No. Or which paragraph? So what do? You look at your neighbor, or you put your hand up and ask. But on the surface, that just looks like you've not been listening. It's naughty. But if there's a working memory problem, that will make those tasks difficult. And in addition, if there is verbal skills difficulty, the actual explanation of what you need to do might be complicated too. So you've suddenly got a very different way of approaching those circumstances. And so we would recommend, especially for children who struggle, break things down, simple language, one at a time, lots of praise, all the sort of adaptations that you can put into place to make very normal instructions much more meaningful for children.
There's a couple of bits that I picked up on what you just said there. So one of the things I've encountered and seen quite a lot in some of the assessments I've come across is you mentioned as far as their expressive communication. So sometimes there's an imbalance in that if we take their chronological age and then you look at their working memory may be lower than their typical chronological age, their but it may be so, but their expressive language can sometimes be higher than their typical chronological age. Is that quite common? Because I've come across that quite a few times.
It is common. It does happen. I mean, I probably see this more because that's the reason why families are coming to us, is because there is probably a problem in the first place. For many children, abilities are generally quite stable across everything. Your brain develops at a consistent rate. Most things develop at the same time. But these are children we're talking about, and children with lots of varying degrees of abilities and different circumstances in their life as well. Everyone's household is different, so everyone will experience the world in their own way. So yes, you absolutely see some things growing faster or slower than perhaps other areas, even from a very young age. Now, as adults, we're very good at labeling that and to call it a problem. So for example, if you take like the terrible twos, for example, let's go very young. The terrible twos is something that every parent will immediately recognize and go, oh yes, the terrible twos, the troublesome threes, all of these sorts of things. But we do that because that is all that's happening there, is that children are developing different skills at different rates. And some skills are much further ahead than others, resulting in behavioral expressions of frustration. So, for example, a 2-year-old might be able to eat perfectly well, but really struggle with a knife and fork, for example. And what does a 2-year-old do in that situation? Throw a knife and fork down, or stomp their feet, or cry, or something that we are very good at saying, oh, they're terrible, they're terrible. It's just different brain development. I mean, I don't think it rolls off the tongue as nicely as terrible twos, neurological differentials. I don't think that's going to catch on. But actually, that is exactly what's happening. And if we continue all the way through the years, your brain continues to grow until your mid-20s. So, of course, that's going to happen. If there are differences, it means the expectation that we put on children might not be where their ability level is at. So if they are 13, 14 years old, they might have some skills that are not quite at the level of a 12-year-old just yet. We're working with children, remember, and that comes out through behavior or the way that they respond to those circumstances. So if we can take that step back and understand, why is this happening? What are they trying to tell us? Or what is going on that's explaining what we see in front of us? We're in a much better place to then support it and understand it.
Within the classroom setting particularly, do you find it sometimes missed because some children become really good at mimicking others? Because you mentioned it a little bit earlier on that I didn't understand that instructions, I didn't follow. So instead of just follow the other children. I know that's quite common in things like dyspraxia and things like that, isn't it? Where they're not always able to kind of visualize the process going to do. So they look over and see what everybody else is doing to kind of just mimic it, which then means that they're masking some of their challenges, but they're displayed in other places. Is that something particularly difficult in school settings?
It certainly can be, because I think there's two big things in here. The first one is masking. So we know that there are children who struggle for a wide range of reasons, either intellectually or academically, they're finding things hard. Neurodevelopmentally, so their social communication, their ability to understand that social world around them might be that bit more tricky. And we see that in autism or ADHD, for example. But lots of children know that certain responses don't always get the best replies from their peers or from their teachers. And so they then mask that, and hide behind it, really control what they're doing because they know that's what helps them to fit in or not be seen or not cause a fuss. There's a problem with that, which is, number one, it means everyone around them doesn't fully understand what's happening for that child. But number two is that takes a huge amount of energy. And so these children are holding it all together and then take one step out of school and go, "Rah," and let it all out. And we see that a lot. Parents often say, as soon as they come out and see me in the playground, or as soon as they're in the car or step through the front door, I just get it in the ear and I've not got a single minute to breathe. And that is children who have literally held it together and suddenly feeling much safer at home and then letting it all out. A credit to parents who've set up a safe, supportive home for children to be able to do that. But yes, not a particularly easy behavior to manage. So yes, that happens a lot. But the second part to this is something that we call social learning theory. And this is how I think children and adults really learn to navigate the world around them. We learn from adults telling us what to do, but it is not the most effective way of learning. The most effective way of learning is seeing your peers do stuff and then them get feedback on that thing. So if you're not sure what to do, just watch someone else, see if they get in trouble or see if they get it right, and then just copy it. Because if they're doing it, surely that means it's okay. That is exceptionally common. And that's actually the basis for things like peer pressure. And well, you can follow that all the way through, or just how relationships form in the playground or at school. We learn from our peers. And so those two factors, the masking and the social learning theory, can make it very difficult for adults to really understand how a child's managing.
One of the things that I try and strongly promote is that I encourage the social learning kind of models that they are more effective for teaching and for learning. And when you are working and supporting with individuals who do have some form of cognitive imbalance or they're split skills, which is the terms I tend to kind of use for it, that's where sometimes the typical behaviorist models of managing behavior kind of really fall down, don't they? Because it's based on the expectations that if I'm punishing you or offering some level of inhibitor, sanction, consequence, whatever preferred term that people like to use, but from a behaviorist point of view, it's essentially punishment, whether positive or negative. That it doesn't work because they're not doing it purposefully. So suddenly that's where we then get the learned helplessness from and things like that. Is that something you find really difficult to help people to understand, because this whole concept of the split skills is something that's so alien to us?
I think you've touched on something that is exceptionally important and that we don't really think about in everyday parenting or everyday life. We just assume, again, because we're not very good at seeing things from outside of our own positions, we assume that children are just going to get it and understand. And we see this whenever we talk with families around punishment and behavior management, that most children know what right and wrong is. They know what appropriate behavior is and what inappropriate behavior is. But parents find themselves pulling their hair out, myself included, funnily enough, to think, well, if you know this, why are you behaving this way? Now, why are you doing this? Without then thinking about their skills, their understanding, their ability, all those things that you just mentioned. And we end up falling into patterns of parenting that we were parented ourselves. And this is an added factor to it. As much as we sit here and say, I'm never going to be like my dad, or I don't want to do what my mum did, you will find yourself being, oh my gosh, I've just done what my dad did and what my mum says. Because that is the way our brains work. From a very young age, your moldable brains essentially become fixed at a very young age based on how you were parented. So that becomes your normal. That's what the expectation is of the world around you. So when you come to be a parent, we might sit here and say, oh, I'm never going to do this, or I'm never going to shout at my kids. And what do you know? That's exactly what happens, because that's how we were parented. And so you end up in situations where you want to try to understand your child's needs, but find yourself snapping much more quickly because probably that's what happened when you were a child. So it's really hard work for a parent to inhibit that and to try to stop and recognize it. But that would absolutely be my recommendation. Really try to not have that emotional response, which is the easiest thing for us to sit here in a nice, calm, quiet environment when you've got kids screaming down your ear and the phone's ringing and the doorbell's going and the homework's not done and stress levels go up, the responses are much more emotional. But yes, that step back is absolutely what we need to try to understand, why is this happening? What's my child trying to communicate? And how do I support this and manage it?
Let me ask you a question. Do you ever find the pressures of supporting, teaching, or caring for someone else overwhelming and wish you had access to more support and information? The Able to Care podcast, in connection with Able Training, has created the ablehub.uk, where for less than the price of a coffee a week, you can access exclusive podcast content, resources, events, and over 45 certified online courses, covering topics like self-care, understanding dementia, neurodiversity, first aid, conflict management, financial advice, and so much more, with new content and courses being added each month. We are so confident that you will benefit from the Able Hub that we are offering 14 days access completely free of charge. No contract, cancel anytime. Become part of the ablehub.uk community and gain the support, knowledge, and resources you deserve. Don't struggle alone. Be able. Find the link in the description. What level of access is there to this? Is there other opportunities to get this from anywhere else as far as assessments are concerned? How can people find this out?
And that's what's really difficult. This is a concept that is many parents aren't even aware of this, because there is just an assumption that they are aged 14, therefore that's where all their skills should be. Whereas actually you've just described it perfectly. There are so many different elements that make up a child that might all be at different areas, but you will only find this out through formal assessments and actually a parent's intuition. The thing that I have found is that most parents who say, I'm concerned about how my child's progressing, are usually, if not always, spot on. And often we see a discrepancy between what happens at home and what happens at school. And that's often because parents can support in a much more meaningful way, but there's only that child at home, maybe a couple of others, or pets causing chaos, but actually it's a much smaller contained environment. Whereas at school, there's 30 kids in a class, 150 kids in a year, loads of different buildings, all of this stuff makes it so much harder to have the time and resource to manage that. So if a parent is thinking something is not quite right, it's just a gut feeling, probably they're right. Something is going on. And that something might not be anything massive. It might just mean a few tweaks are needed to support that child. But it's worth raising it with school to see, is there anything we can do? Now, schools have got a heck of a lot better at this. And this is, I actually feel really sorry for teachers, because almost like teachers are now expected to be doing this as well. And we know professionally, teachers are teachers. They're not psychologists. They're not social workers. And probably they don't want to be those things either. They want to teach. But they are now expected to fully understand a child's overall ability and differing abilities in the context of a whole classroom for however many classes they teach a day. That's a really tricky thing for any teacher to be able to do. So having a document or support with them, with that child, can massively help a teacher. Now, schools have their own internal processes for doing this, but sometimes a child's needs go beyond what a school can offer. And that's where the EHCP process can come in. So that's an educational health and care plan. The theory of it is brilliant, actually. It's that a child's needs are explicitly stated, a child's adaptations are explicitly listed, and that document follows a child through education all the way through to university level. And so it means every single adult in their care knows exactly what this child needs. The theory is great. The practice is really difficult because these are huge documents that take months to prepare, if not years, which is a big problem. And the adaptations put into place are not as easily accessible as they should be. Legally, they should be. If it's in this document, it's a legal document that determines what a child needs. But even then, it doesn't always guarantee that that's exactly what a child is going to get. And so lots of families are incredibly frustrated by this process. And there's a huge backlog of it. But that is, those are the documents that are the formal version of those individual badges that say my ability is this and this is what I need.
Yeah, yeah. It's a shame in some ways, isn't it? I often get frustrated. I'm sure you do yourself as well. That there's still such a, even though we're so much more understanding and we are getting there in many ways, 100%, we're better now than we have been in the past. But there's still this huge difference in understanding around physical disabilities and neurological conditions and differences that I've encountered, and we've recently had a situation with some people who are very close to me, with a girl who has some cognitive imbalance at school being told that she needs to learn to grow up. Now, for me, that's the equivalent of somebody in a wheelchair almost being told you need to learn to walk. And we would consider that immediately to be disability discrimination, that reasonable adjustments aren't being made, that that's prejudicial and stuff like that. But there isn't that understanding around these neurological differences and imbalances, is there?
I absolutely agree. That's a really good comparison and a very appropriate comparison to be making, because it just, in one context, you wouldn't even think about saying it. It's just not a thing. You wouldn't say that to someone in a wheelchair, but yes, we say that a huge amount to children. A child who is emotionally dysregulated, they're not calm. The first thing that parents tend to say is, calm down. In the history of the phrase calm down, has that ever helped someone who's not calm? But that's exactly what needs to happen. They need to calm down, but you can't say it. And that, I think, does show that there is still work for us to do, that there are different approaches that we need to take to support that young person in helping them to calm down. That's meaningful and that's supportive and doesn't take big chunks of that out of their self-esteem or self-belief. It's difficult because on the surface, it just looks like a behavioral reaction, just as we were saying before. But underneath that surface is what we need to know so that we can find out why they're not calm in the first place, to then help them to calm down. It takes more work.
But it's also, again, it's based on his expectations. You'd never think of just telling a baby to calm down. The baby is distressed. The baby is, experiencing a heightened arousal state due to some form of threat detection, whatever that is. I need a primary caregiver. Help me. We don't go in and just go, well, stop feeling that way. We immediately go, well, what's causing this? How can we help this child? Or we look at, hey, maybe you just need me to co-regulate. Maybe we just need my heartbeat to look how safe you are. I'm communicating safety to let you know that everything's okay and I'm here for you. And I find it such a shame that there's a certain change, isn't there? And maybe you could even, you know where that change is a little bit better than I ever would. As far as for children, we allow the expectations to occur based on where they are for a certain age range from baby, like they'll walk when they walk, they'll talk when they talk. I know there's some that will raise red flags and things like that going, hey, my child doesn't seem to be typical. But then we suddenly shift to this whole different, almost looking at it from backwards going, but they should have been it from here. At the beginning, it's all about, we'll work with them to manage their expectations, but then there's reaches at a certain age where suddenly it's a case of, but you should be developed by now. And then people are looking at it from a negative point of view rather than a positive point of view. Have you identified what age that is? Is it just when they start school and the comparisons occur, or where's that happening?
I don't know.
No, it's okay.
I would probably be on the list of Nobel Prizes. But yes, it's an excellent question, and that absolutely does happen. We shift away. You would never do that for a baby, but we do for children at some point. And we have to also consider other things that are going on for parents. When stress levels are really high, we have less resource to offer. Of course we do. So that resource is something that we need to understand so that we can then support children. But you're right, at some point, something changes. And I would strongly encourage parents to try and take that step back again and think about what does my child need at this point? Now, often distress happens because children need something, and they need it, but can't communicate what they need, or don't have the skills to express what they need, or they're just so emotional that they just can't deal with it at that time. But they know that parents can help. But if you are so emotional, you're not in the right place to accept that help. And this is what we call the push-pull, that children are pulling us in because they need our help. Because as you said, we're their primary caregiver. We can give them safety and support. They need us. But as soon as you get too close, if they're not in that right state, they'll just push you away. I can't deal with this. Get out of my space. And we're stood there as parents like, what on earth has just happened? Like, how have I found myself in this situation? What do you want? And then we respond emotionally back to it, which is, you just end up in this eruption of emotion that isn't helping anybody. My suggestions are always be, in that single word, just be. If you are sort of nearby, to sort of say, I'm here when you're ready. I can see you're upset. The validation of the emotion is important. I acknowledge how you're feeling. Not necessarily in those words. You know, if you say to a child, I acknowledge your
age appropriate, yeah.
But that's the message that we're trying to give. You know, I recognize that something is going on here. I'm here to help when you need it. And you just sort of are around, sort of thing. But as soon as they have calmed themselves down, however that looks, then we go back in, because then you're going in that calm time. You're rewarding calmness with your presence, and you're reinforcing that behavior rather than the outburst. So you're saying, I love how calm you are. You've dealt with that really well. That was really difficult. I'm so sorry you've gone through that. Is this something we can talk about? Because you can only do that when you're calm.
Yes.
But yes, it is understanding where all of that is. Now, let's go back to the very beginning about that abstract nature that we talked about. All of this is abstract. These are concepts that aren't tangible. So often I visualize this through like a thermometer. And if you imagine a thermometer, a mood thermometer rather than a temperature thermometer, if you're at the very bottom, you're as calm as can be. At the very top, you're the most emotional you could possibly be. Well, when you're in that top half, you cannot deal with anything at all. Nothing. You're just not in the right place to do anything. You just need to find a way of calming yourself down. But as soon as you see them back in that bottom half, then you can go in. And I often say to families, draw these out, make these thermometers real, stick them on your fridge, pictures of your faces, blob a blue tack and just sort of blob on where you're feeling. And that essentially means you can tell everyone in your family exactly how you're feeling without having to say a single word. And you're making an abstract idea much more concrete. But again, we can find this out through a cognitive assessment.
Fantastic. And yeah, I talk about things like mood monitoring and things like that, 5-point scales. There's loads of different tools out there. We've got some other podcasts on it as well, but there's loads of amazing tools that parents can find quite easily just by Googling to create some tools to help their children better communicate their moods, to create those concrete concepts. They just need to know that that's where the challenge is, which is where, as you say, the assessments are important. So have you seen some cases where is it better the earlier the assessment can occur, the better it is for the child?
Not always. Not always. So I know we talked earlier about prevention, and getting the right support as early as possible is the right thing to do. But sometimes assessments that are done too early can miss the mark. So if we take something like dyslexia, for example, dyslexia or dyscalculia, so these are specific learning difficulties around reading, writing, language processing, and mathematics. If we see young children struggling, we can just think they're dyslexic, and let's do an assessment. But children develop at different rates, as we've been talking about, and actually children can get there eventually. That doesn't necessarily mean that there is any problem. It just means they've just been a bit slower to get it. And assessing at too younger age can often lead to a misdiagnosis. It might look like dyslexia, but it isn't. And we always need time to let that happen. We see this in autism and ADHD assessments. Now, a young child who we might assume is autistic, because of their behaviors, they struggle in social groups. They might be a bit sensory and find certain like noises or lights or textures a bit overwhelming, or they might respond in certain ways that you see, hand flapping or something that is seen to be quite stereotypical of autism. We can go straight to autism, and it might be, but we know that children again develop at different rates, and each one of those things, the social differences, the sensory differences, the behavioral differences, are actually very common for young children. That's how children navigate the world. If a child is overwhelmed with emotion, they can flap their hands because they just don't know what to do with all of that energy. That's not autistic. I mean, it's an autistic-like behavior, but that's just an excited child. And you won't know that until a few more years have passed to be able to formally identify it. And again, sensory stuff. Well, children are learning new textures and tastes all the time. And if they've had a particular fondness of plain, bland pasta, for example, and suddenly you're presenting with something with all sorts of herbs and spices on it, they're not going to like it. So again, is this just a developmental shift? Do we need a bit more time? But if the concerns remain, they're not progressing, or the gap is just ever increasing, then yes, let's formally assess it. And all of these things we can assess from a very young age. It would be down to a clinician to work out with a family, is this the right thing? We also know that there are factors that we absolutely have to account for, which include that wider family development. A child who's brought up in less than ideal circumstances, there might have been a breakdown in the family or worse things such as abuse or terrible things that can happen to children. We know that can affect their development, and we need to make sure that what we're assessing is specifically the autism, not the trauma. This is specifically dyslexia, not just an anxiety about going to school. So we have to be able to separate these things out. That's a lot harder at younger ages. So yes, get involved as early as possible, but only really offer assessments if we're confident that we can separate out all the different factors going on in a child's life.
That makes a lot of sense. Can you think of an example where that early assessment has allowed, maybe to take an example or a case study you come across where some level of that assessment, especially, at the right time, has really kind of improved the outcomes for a particular child?
Absolutely. So I specialize in pediatric neuropsychology, so understanding how children's brains develop. And we can formally assess children's developing brains from 16 weeks of age. So very, very young babies. It's rare that we always assess such a young child, but it's certainly possible. And we obviously are not going to get like a 1-year-old to sit at a table and play games. It doesn't happen. We get out a load of toys, we get on the floor, we're playing and interacting. A huge amount of this is observational stuff. What do they do to work out age appropriate problem solving and working things out? But we're also looking at motor control and language development, and it's called a developmental assessment. Now, when parents are just that little bit concerned, from how their child, say, fitting in nursery, or the nursery staff have just said, there's something going on here, that's very young. So I wouldn't be recommending autism or something like that, but I would absolutely suggest, well, maybe there is this differential ability in their abilities. Maybe they can run around fine, but don't have the communication skills to form meaningful relationships. So a formal assessment there can absolutely help. And it can then help with that transition into preschool or reception years. It can help get the local authority involved if we're thinking we need to go down a specialist school route. We can identify, is this just typical development and they will get there. They're just not there yet. Or maybe there is something going on under the surface. And so I actually travel the UK to do these assessments for very young children because, well, it's a rarity of clinicians who can offer it. So it's part of my specialism. So I would only ever offer it if I'd be confident I know what I am looking for. So it's certainly possible and doable.
So how does the assessments kind of then translate into helping teachers and helping families? How do you find it helps them?
I really like this question, and I really like it because I think this is absolutely essential. We can do the world's best assessment, and it can be incredible, and clinically I'd be super proud of it. But if you present that assessment report and it's meaningless to school or the local authority, or nothing happens as a result of it, it is a waste of everybody's time. So we need to make sure that not only do we get an accurate assessment, but also a meaningful one. So it's going to bring about meaningful support and change. So everything that we do in any developmental or cognitive assessment, we put it into a report that we'd review with families so they know exactly what the recommendations are and what the conclusions are. But then we want that to be translated into meaningful change. So we would encourage that family to share it with school, and within the report are very clear recommendations about what can happen. Now, we do not just recommend things to schools. We found, we used to, but actually took on the feedback that this wasn't helpful for lots of schools. Because let's say we're recommending a child needs extra time in exams, or they need to work in a separate room, or something like that. That's all very well and good, but if the schools either don't have the resource for it, it's impractical. And also, if we're recommending stuff for extra time, it's actually not we don't have the say on that. Schools sometimes don't even have the say. Often there's external exam boards like the JCQ. They're the ones who have the final say. And so we don't want to just suddenly give parents these recommendations that then don't mean anything practically.
Can't be translated, yeah.
Yeah, exactly. So we collaborate with school a huge amount. So if we are doing an assessment, which schools will know we're doing an assessment, we talk with schools and say, look, we're doing this. What would be helpful from your side? What do you think this child needs? What would you hope that they get? And find out what would be practical. It also stops us from just recommending things like someone who struggles with language, saying things like, use a visual timetable. That's probably really patronizing to lots of schools who have already done this. And of course, they're going to try that because they recognize the language differences. So a professional coming in just saying it, they're just going to be like, well, that was helpful. Maybe with a bit more flowery language. But we want to make sure that we get meaningful change. So there's a lot of collaboration that's involved as well with these.
Yeah, that's really good. Is there then interaction with the parents as well, or do you mainly focus on the educational side of things?
No, there is both. Absolutely both. Yeah. Now, often parents come to us by saying they're struggling in school and we need to know why. Of course, then the attention will go to school a lot more, but it should absolutely consider both. It is it's not possible for a child to be autistic at school but not at home. Or have dyslexic tendencies at school but not at home. You've either got it or you don't. So we need that picture across multiple settings. So absolutely parents are involved with this. We can even do the assessments at school if it would help, but often families come to a clinic to do it. It's a much more controlled environment, but it means we get an accurate picture of what parents report and also what school report. And our job, the professional role here, is to integrate that and explain the young person that we see in front of us. So absolutely the parents are a big part of it.
Fantastic. So I'm kind of thinking, as far as the process is concerned, it's such a shame that this isn't a more accessible service. So what are the main barriers that people have for getting these cognitive assessments? Are these available within the NHS? Do they do them? Or is it just a case of you are looking to have to go more private to be able to access this?
No, you shouldn't have to just only go privately. Now, privately, yes, you could pick up the phone to us and we can offer it if it's an appropriate assessment to offer pretty much straight away. But yes, you've got to be aware of it, and then, of course, pay for it independently, which they are significant barriers. Now, if a child is struggling at school, or even struggling at home for things, parents would tell teachers or the staff at school, hopefully, who might be able to do their own screening tests. They might have their own batteries of assessments that they do to find out where someone's at. Lots of schools have access to dyslexia screening tests, processing speed tests. If schools are assessing for something called access arrangements to make sure that a child can be supported appropriately in exams, especially external exams, GCSEs and A-levels, schools have tests to be able to offer it. Their SEN departments can do this. If you want that wider understanding, an educational psychologist might come into school to do it. But if you want that even wider understanding, so you're assessing the emotional and psychological as well as all the other stuff as well, that's where the cognitive assessments come in. And that might need to go to NHS services like CAMS, or other specialist services. But the challenge here is, and the barriers for all of this, is waiting times. Schools will try and do things as quickly as possible, but often there is a small special education needs department for a massive school. Or CAMS, if you were to approach children's services and say, my child's struggling academically, the chance of CAMS accepting that referral, firstly, it's a postcode lottery. Some might be more likely than others, but unless there is a significant risk to their emotional well-being, it's very unlikely that it would be accepted. I'm not saying it won't be, and it's worth checking, but that's how these services are managing such high demand. They're prioritizing the most significant at risk. And so inevitably, many families try to bypass that privately, but shouldn't have to. And there are also charities and organizations out there, community interest groups, social enterprises, and charitable services that do offer these assessments. But it's hard to come by. It's worth Googling and checking and looking around, most certainly.
Would you kind of recommend or would you actually kind of not recommend parents trying to do these in any way themselves before they go down the professional routes?
Do it yourself with caution. And the with caution bit's important. I had a pain in my shoulder the other week, and did the whole NHS 111 thing, put in a couple of symptoms, and then in red it says call an ambulance. And I'm like, I have pressed the wrong button here. That is not what I need. Now, I can manage that, but if you're doing that about a child's emotional development or academic achievement, some online tests can give you, this is a high risk of dyslexia, and can induce a huge amount of panic. You will never get an accurate assessment from a brief, free online screening test. It's not accurate in any shape or form, but it might flag where some problems could be. So if you do any of these free online things, you can, if it raises the possibility that there is something going on here, it's then worth following it up with a professional. But do not take that as a diagnosis. I would absolutely say that. Then speak with school or a professional to see, is there anything more that we can do to help here? Sometimes there are paid services out there as well. And I would be very careful about which ones you use, because some are more malicious than others. Some make you fill out something for free, but then you have to pay to get the results. Some you have to sign up to a monthly subscription if you're paying money and you're not getting a formal diagnosis, I'd be very wary of doing it. That's where the caution comes into it. So speak to teachers, use Trustpilot and Google reviews as a way of saying, is this a validated tool? But also use like the NHS websites that say, if you want to assess for something, how do we go about it? There's like the British Dyslexia Association, and there's the Dyscalculia Foundation. All of these websites and the National Autistic Association, they've all got a huge amount of guidance on, if you're concerned about some part of your child's development, these are the next possible steps to do, rather than you just Googling a free screening test sort of thing.
Okay, thank you so much. And that's really, really good advice for people to kind of take on if there is any concerns. And I think just circling right back, as we're coming to the end of the podcast, circling right back to the beginning where we started talking about kind of child and adolescent mental health. I think all the stuff that we've spoken about, it is something that more people should be aware of, that more people should be talking about, that more parents should be willing to raise up as a kind of concern, and hopefully, seek support if they have any concerns, because this lack of identifying these cognitive imbalances, these challenges, difficulties are often what then destroys self-esteem and child's resilience towards mental health conditions and overcoming adversity within the rest of their life. Would you say that's the case?
That is absolutely the case, without a shadow of a doubt. If a child's needs aren't fully understood, they will interpret it as always getting into trouble. No matter how hard I try, I always get it wrong. Yeah, and we see this even in conversations. When we come to our assessments, we can present a child with a task that we know they can do, but their first response is, "Oh, I'm going to find this so difficult. Oh, I've never been able to do this." Those sorts of comments that immediately flag you're doubting yourself here, or you're putting all sorts of safety nets around the possibility of there being a poor performance to protect your well-being. That's an emotional fragility, and that has come from somewhere. Very likely a misunderstanding of what's going on. So I cannot tell you how frequently we see learning difficulties with emotional and psychological difficulties as well, because those needs aren't fully met, and that child might not actually have the ability to express where their difficulties are. And that, if we keep following that without the right support, that's where the breakdown in school placements come from. That's where relationships with school fall apart. Of course, not always. They are more extreme circumstances, but that's the possible road that families could find themselves on if the right support isn't put into place. We always assess for emotional and psychological distress, because not only can the academic side cause that, it can also be the other way around. So children who's just a little bit fragile for other reasons, stuff going on at home or stuff they've experienced, can have an impact on academic performance. And you end up in this cycle of things going wrong, them feeling worse, things going wrong, and intervening at the right time and supporting it is really helpful. So we also want to try to boost that well-being side of things as well. Very important.
One of the things is, as far as recognizing these neurological differences, these neurological sort of imbalances, understanding the nature of brain plasticity and stuff like that. If it's a case of a child is slightly underdeveloped in a certain area, does that allow us to then kind of actually put in some adaptations to kind of then maybe go back to a slightly different way of teaching and things like that we can actually then promote growth and development in that particular part? Or is that not the case for all children, or does it vary? And yeah, just some information on that would be amazing.
We often hear this from parents. A child we find who's struggling, the next question is, well, will they catch up, or how will we develop those skills? There are some things that, yes, we absolutely can help to promote and to develop. The older you get, the harder that becomes. Your brain becomes more and more fixed. And that's why it's harder for older people to learn new skills. I've always thought I was good at technology, and my son now, who's 9, can do all sorts of stuff on an iPad that I thought, I've literally got no idea how you've done this. That's the sort of real life example of when you get older, it becomes harder. So, and that's the same way through school. So if we are recognizing early on that a child might be struggling from a reading point of view, if we adapt those reading interventions early enough, there's no reason why we can't help to boost that skill. It just needs a different approach. And that's where different reading programs, they exist. There's like the Nessie reading program, the Toe by Toe reading program. I mean, there's a few. Those are 2 of the main ones that are used across the UK. They change the way we teach. So if a child struggles, say, with phonics, that's the main way we teach reading at the moment. We teach the sounds of the words, and then the combination of it, the blending, and then we repeat that over and over as the words and sentences get larger. But actually, if you struggle from a language processing point of view, phonological work is really difficult. So you need a completely different way of managing that. So if you can find that early on enough, there's no reason why that language, that reading then can't develop in the same way. So we can help to develop those skills. It's difficult. It is difficult. Once we've done what we call those cognitive assessments, that is often the place where children will be for the rest of their life. Not always, absolutely not always. But once it's there, unless there is a neurological change or something, you wouldn't necessarily expect those intellectual abilities to change massively. It can, just as we were saying, but it does mean we can make adaptations appropriately. Similarly, like children who are autistic, for example, they might never understand, say, small talk. When you meet someone, oh, hi, how you doing? They might sit there and think, I don't care.
Yeah.
I'm not particularly interested, but then we'll learn that's just what you do. That's what you say. It doesn't matter what their answer is. That's just what you say. And again, that's an adaptation that you learn. So the brain development might not be there, but the adaptations may be. But it does vary, Andrea. That's important. This isn't a one size fits all. It's different for every child.
Yeah, I kind of understood that there's certain conditions are going to affect why that has happened in the first place, and therefore that may never be different as a result of that. Well, this has been an absolutely fascinating conversation. I've genuinely enjoyed it. And I do feel like I could disappear down a deeper rabbit hole with yourself that's maybe a little bit too intense for some listeners to kind of explore more of what you're talking about. But it's been an absolute pleasure having you on and listening to kind of the information and obviously the wealth of knowledge that you have around this. And it sounds like you're doing amazing work as far as, helping families and helping teachers improve the connections and understanding of the children they're supporting. And that's so important. So how can people find more out about your service and what you guys do?
Oh, thank you. That's really kind of you to say those things. And we try. But yes, if anybody wants any more information, our company is called CAYP Psychology, CAYP Psychology. We have a website, www.cape-psychology.com. If you just type us into Google, Children's Psychological Services, we often do appear as well. We're all over social media. It's not me who does that because, as I said, my brain is now too to get my head around it. My colleagues certainly help out there. But they can also pick up the phone or get in touch by WhatsApp as well.
Thank you so much for joining. Really appreciate it. Hope you found that an interesting conversation as well.
I certainly did. Really appreciate it. And to have the opportunity to talk through things is wonderful. So thank you so much.
And for anybody out there who's found the information we've talked about interesting, useful, or somebody who might benefit from this, please like, comment, and share. Check out in the show notes the details of how to contact Dr. Weisberg and his colleagues. And otherwise, thank you very much for listening, and thank you once more, Daniel.
Have you ever encountered an adult or child's behaviour that has felt difficult, overwhelming, or challenging? Have you sometimes felt at a loss of what to do, or know that you didn't handle it quite right? People are complex and unpredictable, and their behaviour can be like the weather. We've all made the mistake of looking out the window and feeling safe to wear shorts, but 5 minutes later wishing for an umbrella. What if, like a weatherman, you understood how humidity, temperature, and pressure all come together to cause the weather, allowing you to better prepare, predict, and respond, and prevent ever having a picnic ruined by a thunderstorm ever again? My book, called Targeting the Positive with Behaviours that Challenge, helps you to become the weatherman of behaviour. It provides you with a toolkit to increase competency, confidence, resilience, and empathy, so you feel more assured about how to respond to distressed or dysregulated behaviours in others, including those affected by trauma, mental health, neurodiversity, learning disabilities, or dementia. Build better connections, achieve de-escalation, and improve outcomes for yourself and those you engage with my celebrated 6-stage target model, a step-by-step process to reduce distress for everyone. Discover my empowering, person-centered guide in Targeting the Positive, written by me, Andy Baker, available from online bookstores worldwide. Find a link in the description and order today.